It's been a really stormy time since Jeremy's initial diagnosis. We've been rescued, I would say, quite often by the NHS. It's been like a life jacket, really, for me as well as for the whole family.
Sarah and I moved here in 1993. We have 3 children. They're very proud to say that they are from Peckham. Well, I would say that our kids are absolute testimony to how fantastic state education is and also how brilliant local public services can be. I started to feel unwell, so I did what all men do, was ignored it until it got to the case where I couldn't ignore it anymore. I was given a cancer diagnosis in December 2017, but also extensive liver disease because the cancer has spread into my liver and I had multiple lesions in my liver. And then on the 3rd of May we got the really, really bad news that despite all the chemotherapy, despite all the surgery, nothing had worked. And unfortunately that's when I got the terminal diagnosis with 12 months as the sort of time left. I have joint counselling with Sarah, and we were able to work through strategies for how we told the children, because that was quite a difficult conversation with them.
We've always been given a sense of direction as well, sort of like this, there's been a compass to help us through, to help us navigate this unknown territory for us. There's also been the complementary therapies that have been available both at Guy's in the Dimbleby Centre and at St Christopher's Hospice. In a way, those have provided the space I've needed in order to carry on being a strength to Jeremy and to the family as a whole.
The way in which the extended primary care has been commissioned, the way in which the commissioners have worked with the providers to get the service specifications right, the way the providers work together, Guy's, King's and for me, St Christopher's in the practice, all works very well indeed, and I think that has only been of a massive benefit to me. The dynamic between the cancer centre and the GP practice was absolutely, I couldn't fault it. So from their internal MDT at King's and Guy's through to me starting chemotherapy was just a matter of weeks. The way in which the practice and the pharmacy work together to change the medications, I just do it online through Evergreen. I then ring the pharmacy and say, is it ready? And they say yes, and I go and pick them up. So that all works. And also I book all my appointments through Evergreen as well. So I just feel that people are looking out for me. If they feel there's something wrong, they'll give me a call. If they feel there's something else that needs to be done, they'll involve me in that conversation. And no decision has been made without me. I feel very in control of what's going on. So whatever investment the CCG has made, I can really see some of the tangible benefit. I feel very positive about what's going to happen to me over the next 6-9 months in terms of the palliative care that I'm going to receive at St Christopher's. I mean, it's such a great place to go, and there's someone there to talk to all the time. My experience of the last roughly 12 months now is that there is a system in Southwark, and it is working, for better or for worse, but my experience of it is definitely for the better. The NHS has absolutely wrapped itself around me and the family in terms of the care and the services that it has offered us over the last 9 to 10 months.
I just feel really looked after, like a comfort blanket goes around you.
Well, what we have got and what the NHS has served up to us is absolutely what I would expect the NHS in Southwark to deliver. And it absolutely has.